I'm Dr. Deborah Pan, board-certified plastic surgeon at ESANA Plastic Surgery Center and Med Spa. Today, we're going to talk about fat reduction technology and how we evaluate which technology or procedure would be right for you. When we first talk about the abdomen, we talk about two different compartments of fat. First of all, there's the fat compartment underneath the skin. That's what we call subcutaneous fat. As you can see here, that layer is demonstrated by when I press on the skin down to the level of the muscle. Typically, if that layer is between 1 to 2 inches, we can then discuss certain options. The other compartment of fat is what we call visceral fat. Visceral fat is the fat layer that surrounds our internal organs and is within the abdomen itself, which is underneath the muscle. Unfortunately, that layer of fat cannot be reduced surgically or with any of our technologies. That fat layer is only encountered and reduced by diet and exercise, or in some cases, certain bariatric weight loss surgical procedures, such as gastric bypass or laparoscopic gastric banding. In our offices, what we can do to help contour the superficial subcutaneous fat include CoolSculpting, liposuction, as well as abdominoplasty, or otherwise known as a tummy tuck. On our model here, you can see that she has some subcutaneous fat, and these are areas that are very amenable to the non-invasive CoolSculpting technologies. As long as the areas of skin and fat can be pulled away from the body, those are areas that we can treat. Most commonly, we have areas including the lower abdomen, as well as the upper abdomen, the flanks, and other areas that are not included in this picture are the inner thighs and sometimes areas of the back that are underneath the bra strap. For a more invasive procedure, we can offer some liposuction depending on the patient's desires and wishes. That involves some anesthesia as well as a cannula that is inserted underneath the skin to actually mechanically remove areas of fat in widespread areas of the body. That can sometimes offer a more drastic recontouring of the body itself. Lastly, abdominoplasty would be the most invasive option but can produce the most dramatic results. In some cases where there may be too much excess skin, abdominoplasty or tummy tuck may be the best option. In that case, actual surgery is performed to remove skin of the lower abdomen. The skin removed typically goes from the belly button all the way down to the bikini line. And the fat underneath the skin in that whole area is actually removed physically. From there, the muscles can be repaired underneath that may have been stretched during pregnancy or weight loss. Once the tissues are then redraped over the flattened muscular platform, the entire abdomen can be drastically contoured and improved. In many cases, if you're unsure which treatment is correct for you, our free consultation will provide the answers that you need. From CoolSculpting, you can experience no downtime or very little discomfort, and you can get right back to your routine activities. Liposuction does encounter some downtime, which may include some soreness and some compression garment wearing for about 2 to 3 weeks after the procedure. Tummy tuck surgery has about a 3 to 4 week downtime where you're not off your feet completely, but there is some surgical recovery. For more information, please visit our website at www.esanamedspa.com.